My name is Lisa Meyer, and I am a physical therapist. I went to St. Louis U many years ago for my physical therapy degree and worked primarily in senior living, long-term care for the majority of my career. Started with really providing patient care to the older adults and then moved into various management positions. Really found a passion for working with residents or patients living with dementia. And so I last year was able to get my certified dementia practitioner certification, which really means that I've had some additional training versus what maybe your normal healthcare provider would have in taking care of persons living with dementia. So very excited to be here tonight. Our agenda is we're going to go through some of the signs and symptoms of dementia. We're going to talk about some of the strategies for effective and compassionate communication, talk about the available care and support options, as well as some guidance for families at every stage of the journey. So when we talk about dementia, probably the one most people are familiar with is Alzheimer's. It's very well publicized. It's talked about a lot. A lot of people mispronounce it and they'll call it old-timers, which I think is kind of funny. But Alzheimer's is a form of dementia, and that disease was named after a physician who discovered that. But dementia really is an umbrella term that can cover a variety of diseases that cause conditions that impair the brain. So Alzheimer's disease is the one that's most common. You'll also hear something called frontotemporal dementia, and it impacts a different part of the brain. So there will be some additional behaviors or moods that are altered because of where this dementia is located. There's also one called Lewy body dementia, which is one that is not only memory loss, but there's a motor component. So people with Lewy body dementia typically have a lot of trouble with movement, spasms, inability to walk, freezing of movements, things like that. And then vascular dementia. And as it sounds, vascular meaning related to the blood supply. And so that causes a dementia because of a lack of blood supply to different parts of the brain. So these are just 4 of the many types of dementia, but I wanted you to be able to see that not all dementia is Alzheimer's. When you are with your loved one and you get the diagnosis of dementia from your primary care provider, it's really important to ask what type of dementia it is, because the treatment and the response is going to be very different depending on what it is. So not all dementia is going to look alike. So if you are with your mom or your sister or someone and you get that doctor gives you the diagnosis of dementia, make sure you ask what type it is, and that will help lead to some better decisions about treatment and care planning. So what are the signs and symptoms of dementia? First and foremost, I think what everyone thinks of is memory loss. And I think every one of us in this room has probably misplaced something, forgot something. That's not meaning you have dementia. It's memory loss, and we'll talk a little bit more about what that looks like, but it's being not able to retrieve certain pieces of information from your brain. And we're all going to have those episodes from time to time where you can't remember something. This is going to be more chronic and more consistent. Folks with dementia also have challenges with problem solving. So maybe they were able to, figure out a solution to something that was coming up in the past, and now they're confused and can't figure it out. And I'll try to give you a few examples along the way, just to help put some of these things in perspective, especially if they're a little bit more unfamiliar. But difficulty completing familiar tasks is, I think, the one that usually starts to pop up first. You see one of your loved ones who now maybe is going to have a diagnosis of dementia, and they're forgetting how to do things like turn on the microwave, or they start cooking something and forget the next step, or they always used to lock the door before they went to bed at night, and now they're forgetting to do some of these things. So really familiar tasks that they're used to doing all the time, they start to have some difficulty completing these tasks, and that could be one of the early signs of dementia. A big one is confusion with time or place, not so much person. So your loved one might still remember who you are, remember that you're my daughter, remember that you're my sister, but they might have the time frame mixed up. So it might be, I remember you when you were in high school versus remembering you right now. Or I know that I'm at home, but I don't remember the name of the place that I'm living in that is called my home. So that confusion with time or place is, again, one of those early signs or symptoms. Interestingly enough, visual changes can go into this as well. So it's why it's very important for all of us to have our vision checked every year. And I think a lot of people are very comfortable with that. I see a lot of people wearing glasses here, so you usually end up going. But someone who's maybe had normal vision, or their vision hasn't changed much and now all of a sudden it starts to change, that could be a sign that there's some dementia starting to appear. And that's when people will start to see things that maybe aren't there, or they'll start to have trouble completing some of those tasks. And some of that could be related to visual change, which is really a sign that something is happening in the brain. Difficulty communicating is a really interesting one. So forgetting the name of somebody or talking around it to say, when I went and did that thing with your sister, that place we used to go to, and they're having trouble finding those words, that could be a sign that you're starting to have some signs of dementia. So not being able to just carry on that normal conversation that you would have, there's definitely some things where you're having trouble communicating. Misplacing things is a big one, and it's not usually just I can't remember where I put my glasses, but maybe I put my glasses in a place like the refrigerator or in a different room, and it's a little bit out of the ordinary. Especially in the early signs of dementia, someone will say, oh, I didn't put those there, someone else might have done that, or someone else moved my glasses and put them in the refrigerator, because they're experiencing some of these changes, maybe aren't necessarily really willing to admit that that's going on, or they just don't really remember. So when you start to see some of those things, especially when you're over at a family member's house and you start to see something doesn't seem quite right, these might be some of the things that you'll pick up on, especially with misplacing things. Decreased judgment is really an important one to identify early, because it is a safety issue. So someone who maybe always walked with a cane now decides they don't really need their cane when they go outside, or they've never gone out to get their mail and now they all of a sudden decide I'm going to go out and get my mail, and it's raining and it's dark out and the judgment isn't really there. That could be a sign of early stages of dementia. One that I think we as healthcare professionals try to pick up earlier rather than later is when they start to withdraw from work or social situations. Sometimes that's because they don't understand what's going on, and it's easier for them just to retreat back to their safe place, which is usually home or their bedroom. So when someone like your mom decides she's not wanting to go play cards anymore, or she doesn't want to go out to dinner anymore, that's usually a sign that something else is going on, and she may not come right out and say, I don't want to go because I can't hear everybody, or I can't understand what's happening, or I'm afraid I'm going to get lost. But just those examples of not wanting to be active in some of the social activities or work-related activities that they normally did, that's going to be another early sign. And then changes in mood or personality. Just a little funny story about that. My great-grandmother was never a very nice person. She always was very crabby, and my sisters and I were always afraid when we went to visit her, and she ended up with dementia and ended up in a skilled nursing facility, and we went to visit her, and everyone when we got there was like, oh, your grandma's Viola, we just love her, she is the sweetest person. And we're like, are we talking about the same person? And yes, she did become a very sweet person later on in life. And so in our case, that changed for the positive, but you may see some things where that mood or that personality will change, maybe not as friendly and positive as it was in the future. So we're going to talk a little bit about the highlights of dementia, and most of this information I've pulled from the Alzheimer's Association website. There is a ton of information out there, but I think it's important to know that currently there's over 7 million Americans living with Alzheimer's, and that's projected to double up to 14 million by the year 2060, which is really kind of scary, because Right now, there's not any kind of a cure for Alzheimer's disease or any of the other dementias. So we do need to have a better understanding of what dementia is and how we can, communicate with those with it, deal with it, treatment options, what there is, and really taking a look at this from the holistic point of view that majority of the people with dementia or Alzheimer's are going to be over the age of 75. So we need to be looking ahead, and if you have someone in your family that's above that age and they're not showing any signs, there's a pretty good chance that they still may develop something. So we want to be aware of that that's a very prevalent disease. 11% of people over the age of 65 have a diagnosis of Alzheimer's. So that's pretty high, I think. 65, I'm 60, almost 61, and to think that, in a couple of years, 11% of my peers are going to have Alzheimer's, that's kind of scary. It is more prevalent in Black and Hispanic Americans versus white, and the majority of the folks that end up with Alzheimer's are women. And don't know why. Part of it is I think that women live longer than men, so there are odds that it's going to be more prevalent, but that is something to be mindful of. Anyone who has dementia or Alzheimer's is going to be more likely to have other chronic conditions. They're going to be twice as likely to have hospital stays, and they're going to make up a large portion of those living in nursing homes. So that's kind of another sombering thought, that this is what happens when people have dementia. They're going to have a lot of medical issues. They may end up in the hospital more, and they may end up living the last part of their life in a nursing home. Currently, 1 in 3 older adults that dies has dementia. May not be real significant, but they do have that as part of their diagnosis. And as a result, the deaths from Alzheimer's have increased 142% in the last 25 years. And the deaths for heart disease have actually decreased over that same time period. So we've made some progress with heart disease and treating that, but not so much with Alzheimer's. And if you look at the deaths from Alzheimer's, they make up more than breast cancer and prostate cancer combined, which is, again, kind of sombering. In Missouri, there's more than 120,000 people living with Alzheimer's, and about 3,000 of those will die from the disease each year. So, again, I don't want to bring everybody's mood down, but it is pretty important for us all to know that it is out there and it's something we need to be aware of. So there's various ways that we stage dementia, different types of classification systems, but I'm going to break it down into early, middle, and late stage because I think that makes it a little bit easier. The early stage of dementia usually lasts between 2 and 4 years. The thing that's really important to understand with a person living with dementia is you want to make sure you focus on the abilities that they still have and not dwell so much on what they can't do anymore. So in this early stage, they can still be oriented to person and place. They can still know that you're my daughter and I'm living at home and I'm living in St. Louis. Just may not know what time it is. They may be able to figure out it's the summertime but don't remember that it's June. They can still learn new tasks in this early stage. So as a physical therapist, if I'm working with a resident who has some balance issues, I can still teach them how to use a walker or teach them how to use a cane while they're still in this early stage. They can still self-administer medications using a pill box. So you don't have all the pill bottles maybe laying on the table and try to sort through and pick them out, but if you set up the pill box for them, they know to take the pills in order of the dates through the pill box. They're also going to be able to continue to be independent with bathing, dressing, and eating, and they can follow written instructions. So as a physical therapist, I can put a note on someone's door that says, Mary, don't leave the apartment without your walker. And Mary will read that, and she'll remember to get her walker. That doesn't happen necessarily in some of the later stages of dementia, but these might be some helpful things if you're working with someone or living with someone who has some of these early stages of dementia. These are some things that they can still do. The things that they're going to have problems with is going to be more higher level, what I call executive functions. They're going to have trouble balancing their checkbook or paying their bills. They're going to have trouble remembering recent events, but they can tell you a story about something that happened 30 years ago in great detail. They're going to have trouble finding familiar places, which is kind of a scary thought. That's why you have to worry about safety. You know, if they were always walking to the grocery store up the street And now they walk to the grocery store and they can't remember how to come back home, or they get lost on the way to the grocery store. That potentially is a safety issue. Sometimes they'll start losing interest in their hobbies, and that's because they maybe can't remember the steps to doing a puzzle or some kind of a craft activity, or it's just becoming too difficult for them. And they won't tell you that it's difficult. They'll just say, no, I don't really want to do that anymore. There'll be some mild mood or personality changes, and they'll also start to forget the names of people and things. So I'll use my mom as an example. She does not have dementia, but she had a stroke about 4 years ago, and the residual of her stroke is word finding. So she never could remember the names of me and my sisters. When she was mad, she always yelled at Laura, even if it wasn't Laura. When she was happy, she yelled at Chris. She never said my name. But now she has a hard time getting to Laura or to Chris or to Lisa, mainly because of her stroke. We all understand that at our house, but if she's out in public and she's trying to explain to someone what she needs and she can't come up with the right word, or she can't remember the name of the thing that she wants, that could put her at risk for any kind of issue. So that's the early stages of dementia. The middle stage can last anywhere between 2 and 10 years. And at this stage, the person can still be oriented to their person, their self, their spouse. They're probably not going to know exactly what place they're in. They might say home, but they don't really know where their home is. They can also complete the majority of their bathing, dressing, and grooming, but they may need some assistance. So if your loved one decides they're going to go get dressed and they open up the closet door and there's 15 shirts to pick out, they may not want to change their clothes that day because they can't make that decision on how to pick out their shirt. Now, me as the caregiver or the spouse, I can pull out 2 shirts and say, which one do you want to wear? And they can pick which one to wear. But if I just said, go in and get dressed, they may not be able to do that. Same thing with bathing. That you talk about going to take a shower. They may not go in there and take the shower. They may go in there and forget why they're in there and not take the shower, or forget to thoroughly wash themselves. So there may need to be some assistance there. May just need to be some reminders, may need to be some physical assistance. They can usually feed themselves still, but they have difficulty choosing what to eat. So taking them to a buffet would not be the best thing because there's too many options. But if you put the food down in front of them, they're able to eat. They'll walk, but they're not necessarily sure where to go. So they may be wandering around, especially living in a community where there's a lot of space to walk, but they may forget where they're going or why they're going, but they're still able to walk. They can follow short, simple instructions, and I think the interesting thing about dementia is the processing time in their brain has slowed. So if you say, can you pick up your socks? It may take them as long as 60 seconds to really fully hear that before they pick up their socks. So to give them a lot of instructions, you have to be really patient and spend a lot of time trying not to do it for them and give them that opportunity to do it themselves. But if I said, why don't you go over there and pick up the blue socks and put them on, that's too much. You need to make it very direct. Pick up your socks, put on your socks. And they can do familiar tasks like dusting and folding clothes. So, they want to help out, they want to do something, and dusting is something that I'm pretty sure we have all done many, many times. Give them a dust rag, let them go to town. Give them a basket of clothes, let them go to town. They'll help with those kinds of things, and it does give them a purpose and keeps them engaged in things. The worst thing you can do is to not engage and not interact and just have them sitting there watching TV and sleeping all day long. Keep them active, keep them doing things, and these are some of the things that they can still do. Some of the big problems in this middle stage are being forgetful of recent events. So it could even just be as early as this morning, you had Cheerios for breakfast, and at lunchtime I'll say, what did you have for breakfast? I don't know, did I eat breakfast? They can't remember what they had. They may have difficulty sleeping, and some of this is related to the circadian rhythms are going to be mixed up. You don't know if it's day or night. You don't know if you're up or you're down. it can, and it's a kind of a vicious cycle too, because you have difficulty sleeping, and then that doesn't help with your memory the next day, and then you have difficulty sleeping again that night, and it does turn into kind of a vicious cycle. Sleep hygiene is one of the things that we could do a whole presentation on, and I would say probably there's many people in this room that don't sleep a full night, and you notice it the next day when you haven't had a good night's sleep. It's even worse when you have somebody living with dementia. They're going to be very distractible too. So you might be having a conversation with your mom and a little kitten walks by and, oh, look at the cat, look at the cat. Well, no, Mom, we're having a conversation here, but they're going to be very distracted by the little cat that's going by. They may ask the same questions over and over again. And does this sound like maybe having a 2 or 3-year-old where they keep asking the same question over and over again? Yes. There is a theory with dementias that it's the theory of retrogenesis, that you actually kind of start to work backwards in terms of your developmental age as you progress through dementia. So at this stage, you may function more like a 3 or 4-year-old in terms of some of these things that you can do and things that you can't do. So you have to kind of keep that in mind. If you had a toddler at home, they'd probably have a very short attention span, and you're going to have to keep them doing things or they're going to get into trouble, right? So that's what you want to think about when you're looking at folks with dementia, that there's going to be some times where you've got to keep moving, keep things going, keep them interested and out of trouble. They're going to not know why they're doing something. So they may ask you, why am I doing this? Why am I stirring this? Why am I in the kitchen doing this? Because they've already forgotten why they went in there to do that. At the middle stage, they're going to be unable to handle any kind of finances or shopping. They can do some mild housekeeping, definitely not driving. And they're going to have more of those word recall problems, trouble communicating what they need. You may see this in a variety of different ways. Some people will become agitated because you don't understand what they need, or they're just not able to get those words out. Again, think about it as a small child. Sometimes they have a hard time communicating to us what it is that they need. So these are some of the things that you'll see in that middle stage. But again, from a therapeutic standpoint, think about the things that they still can do at that stage and focus on their remaining abilities instead of dwelling so much on their disabilities. And now we have the late stage of dementia, which can last up to 1 to 3 years. At this stage, they can still drink from a cup, usually with help. They can speak 1 to 2 words. Typically, they'll eat finger foods at this stage. So to put a plate with 3 different items on there and utensils, they're probably not going to feed themselves. But if you cut up some chicken strips or some pieces of cheese or pieces of fruit, they can pick it up and go ahead and eat it. They enjoy music, bright colors, and familiar scents. So you want to think about that when if you're going to visit someone, maybe you're wearing a bright pink blouse or a bright blue blouse. They're going to love that and be able to distinguish that. Sometimes we'll just play music, and we use music a lot in physical therapy as a way to help people get into rhythm and to be reminded of some of those things in their past. And when you use music, you don't want to use music that necessarily you like, but you want the music that they are comfortable with. I've gone into skilled nursing facilities before, certainly not at Friendship Village, where you walk in and there's all kinds of crazy like rap music going on because that's what the aides wanted to listen to. Well, if you're 80 years old, you have no idea what that music is, and it's not helpful at all. It's actually distracting. At this late stage of dementia, the resident can usually sit up and move their arms and legs, but may not be able to safely walk. So problems that you'll see, they're going to be disoriented to person, place, and time at this stage. Very limited attention span. They cannot bathe or dress themselves. They're going to require assistance to toilet. Sometimes they'll resist care or appear restless, and you'll see falls or difficulty swallowing at this stage. So again, think about the theory of retrogenesis. As we're moving to the later stages, it's more like the infant stage in development. Not able to care for themselves, not be able to communicate their needs and wants, and have trouble with some of these other care activities. So let's talk about some of the strategies for communication, because I think that's really important, especially for family members who have a loved one who's maybe in a memory care community. You don't know what to do. You don't know how to do a visit. You don't know what to say. It's important to remember this is a person, and we don't necessarily know exactly how much they understand at each particular stage of the disease. But in that early stage, you want to make sure that you're speaking directly to that person and not about them. And that gets really difficult, especially when you go to a medical appointment and they start talking about things that are maybe a little bit more high level. You want to make sure that they're including that person in the discussion, even if they don't have the ability to respond or to be an active part in that. You want to make sure that you're speaking directly to that person and not about them. You also want to take time to listen to their thoughts. You know, it's a devastating diagnosis to get diagnosed with a form of dementia. And there's going to be somewhat of a grieving process. You know, this is not my normal life. This is going to be my new normal. And so you want to make sure that you've got some time to really listen to their thoughts and let that sink in. Like I mentioned before, you want to give that person time to respond, because there is going to be a delay in how long they're able to receive the information, formulate an answer, and give it back. And probably most importantly is don't interrupt them when they are talking, because you want to hear what they have to say. And that can be really hard, especially if you want to be the problem solver and get to a solution right away. But just allow them to have that opportunity to be heard. In the middle stage of dementia, it's best to have conversations in a quiet place. It's very distracting when you're in a big group or in a big environment where there's a lot of other conversations going on, maybe some lights or other noise. Have those conversations in a quiet place. You want to speak slowly and clearly, and by all means maintain eye contact so they know that you're talking to them. And even if they're having trouble understanding the words, they'll understand with the eye contact that you're listening to them and you care about them. You want to ask one question at a time. And again, that's sometimes hard for us. We want to get to the point and start asking a lot of questions. But if you can ask yes/no questions, you're going to have a better time communicating with someone. If you say, do you want to go outside and we're going to do this, or we could go do this, or maybe we should do this, way too much information. Do you want to go outside? Yes or no. Do you want to put on your sweater to go outside? Yes or no. That's going to make it a lot easier for them to understand what's going on. And you want to avoid criticizing or correcting. And I don't know if you've heard this term before, but when you're working with folks with dementia or Alzheimer's, you want to live in their present. So you don't want to say, no, Mom, Dad died 4 years ago. You remember that. That's not going to be helpful at all. You want to just talk about, okay, yeah, Dad, tell me why you and Dad got married. You know, where did you live when you got married? What kind of things did you like to do? Just kind of change that conversation around so you're having the conversation about Dad, but you're not trying to correct and say, Dad died 4 years ago, because they're going to ask the same question again in 20 minutes when they've forgotten that Dad died. It's also really kind of sad if you have to keep having that same conversation. You know, they have to keep reliving the fact that their husband died every 20 minutes. You know, just better to kind of let them talk and have that conversation about, you know, tell me more about Dad. In the late stage of dementia, it's really hard to know how to communicate with someone. Most importantly, you want to make sure that you approach them from the front and make that eye contact. You never want to come up from behind or from the side, because they don't see you coming and it can startle them. You want to use touch and sight and sounds as a form of communication. So you may not be able to have a full conversation with them, but you can sit with them and hold their hand, or talk to them about, you know, Joey did this today. Bobby did this today. Mom, I brought you some flowers. Let her smell the flowers that you brought in. Maybe have some music on, again, appropriate for them. It doesn't all have to be about a one-on-one conversation with someone. It can just be being there. And the last comment I put was just be present. They'll know you're there, and that's really important. And by all means, don't talk down to the person as if they weren't there. And I think healthcare professionals, we all get caught up in that. Sometimes we're so busy with the work that we have to do and what's going on, we might be talking about that person when they're right there. Include them in that conversation, even if they're not going to be able to speak back. So, after all that, now what? So there are a ton of resources out there, and that's the biggest part of this conversation that I want to get across to you guys is no matter where you're at in the journey, no matter what stage someone's in, no matter where they're living, there are resources available. First and foremost, the Alzheimer's Association. They have so much information on their website that you could be on there every day and you'll probably pick up something new. There's information about latest research, they talk about medications, there's different support groups and things like that. So that's always a great place to start. Whether you have the diagnosis of Alzheimer's or just dementia, start with the Alzheimer's Association. There's an organization in St. Louis that we're very lucky to have called Memory Care Home Solutions. They are actually a not-for-profit that was started by 2 occupational therapists to provide those resources to family members. They're based off of West Pine, not too far from the Barnes campus area. And they have so many resources available no matter what stage you're at. I'll talk a little bit more about one of the programs that they're participating in. But that's a great resource we have here in St. Louis, and there's a ton of information on their website as well. We have a lot of senior living communities in the St. Louis area, and senior living communities include assisted living, independent living, memory care. Many of those communities have resources that you can talk to. Nicole's a perfect example, and Bridget's here too. I'm glad to see that. These guys have done this for a long time, and they can help you find those resources or help answer some of those questions for you. Just need to ask. There's a lot of support groups out there too, and not all of them are in person. There's some that are even online. And I personally went through some grief a few years ago and started attending a support group, and I did not think I would attend a support group because I wasn't going to be one of those people that talked. But just being there and listening to other people talk was so helpful for me that I think you would see the benefits of that. Again, you don't have to get up and talk. It's not like a 12-step alcoholic program where you have to get up and say anything. No, you're there to be with like-minded people who maybe have dealt with something that you're now exposed to and you need some help. There's adult daycare programs and respite care. So if you are caring for someone, you can take them to an adult daycare location a couple days a week where they have activities. They have meals. Sometimes they'll help with some of the ADLs. There's also respite care where you maybe, as a caregiver, need a break and you can have someone go to a community, maybe have a couple overnight stay, take a week's vacation. I think the best part about that is if you're the caregiver, you need to take care of yourself first because you can't care for somebody else if you can't feel like you're taking care of yourself first. You've got to be healthy and strong. So you need to tap into some of these resources like adult daycare or respite care. I'll put in a big plug here for physical, occupational, and speech therapy. I think they're wonderful for working with folks with dementia. Physical therapy obviously works on balance and strengthening and use of assistive devices. Occupational therapy works on bathing and dressing and some fine motor things. And there are so many different pieces of equipment out there that if you're having trouble with something, they can help figure out what's going to work best. And speech therapist is not just about speaking, but it's about swallowing, it's about cognition. And so getting a referral for any or all 3 of those disciplines for your loved one is a huge advantage because then you'll get some additional tools and some training on how to assist. And then a social worker. A social worker knows what resources are available in the area. So whether it's in the hospital setting or in some of the long-term care settings, there's people out there that have these resources for you. So I'm going to talk a little bit now about a new program that Medicare put into place. It's called the GUIDE program, and it actually went into place July of last year. And GUIDE stands for Guiding an Improved Dementia Experience, which is where they came up with the GUIDE part. And the focus is on comprehensive, coordinated dementia care, and it aims to improve the quality of life for people living with dementia, reducing the strain on unpaid caregivers, and enables people with dementia to remain in their homes or communities. So you might ask yourself, why would Medicare pay for something like this when they don't pay for so many things? Well, the burden on caregivers is huge. And the burden on the healthcare system is huge. To take care of someone in a skilled nursing facility is very costly. And so putting this pilot program together has enabled providers to be able to offer resources and support to those living with dementia. There's a criteria for eligibility. Obviously, you have to have a diagnosis of dementia to participate in this program. You have to be enrolled in traditional Medicare Part A and Medicare Part B. So right now it does not cover a Medicare Advantage plan, only the traditional Medicare A and B. You currently cannot be receiving hospice benefits, and you do not live in a skilled nursing facility. But you can live in an assisted living community, you can live in an independent living community, you can live at home or in a memory care community, just not skilled nursing. So this slide here is kind of a little picture of what Medicare put together to show why they came up with this program. So on the left is the common dementia care experience. And this is where, in this case, this woman and her daughter just get the diagnosis of dementia, and they're not really sure what that means or what to do. And so they're going down the path, and maybe they talk to one person and they tell them to do this, and then they go down the path and talk to someone else and they tell them to do this, and now they get to the third person and what they told them is different than what the first person told them, and now they're not sure what to do, so now they don't know how to make any decisions. Or the mom gets admitted to the hospital and the hospital says, well, she needs to go to a nursing home, when you don't know why does she need to go to a nursing home? She was living home with me. So it's very complicated and very difficult for a family or a caregiver to navigate through this because there's so many different healthcare professionals out there. So the GUIDE program was intended to help people through this process by assigning a care navigator. And that care navigator is the person that's going to help guide you through that process. So maybe you get the diagnosis and you start on some medication and now you end up in the hospital because of a urinary tract infection. Well, maybe they changed the medication that they were on before that and it's not working out well. That care navigator can step in and help you be directed to the next step. Maybe it's not that you just continue with that same physician, maybe it's a referral to someone else. So it's all going to be helpful to the caregiver to navigate through this path and make sure that we're keeping that best interest of the resident or the patient in mind. So when this program went into place, there was 350 partner organizations that were named, including several in the St. Louis area. Empower Me Wellness was the first one in the St. Louis area that became part of this program. I previously worked for Empower Me Wellness before I came to St. Louis University in March, so I'm very familiar with this program. They currently are on site at Friendship Village in Chesterfield, and I'll talk a little bit more about their program, but the other GUIDE partners will be Memory Care Home Solutions, which I already mentioned, Harmonic Medical Group, and Ripple, and the last two are considered telehealth, so their GUIDE program is delivered all through telehealth visits, not in person. The Empower Me Wellness program, the way that they've chosen to handle it is they have a physical occupational therapist already on site, and they can function as that care navigator. So they will speak with that resident who's enrolled in that program and help answer questions and provide direction and guide the person through those resources. Interesting enough, Medicare didn't put a lot of a playbook together on exactly what it needs to look like. There's just supposed to be providing those resources based on what the needs are. And every resident or patient, who becomes part of the GUIDE program gets that comprehensive assessment in the beginning. And that's going to determine what the medical, physical, and psychosocial needs are going to be. So you're going to have different needs than you are, and we want to make sure that that's a very person-directed care plan. That care coordination is going to happen through a dedicated care navigator. So if your loved one is part of the GUIDE program, you're going to know who your care navigator is, and you're going to call and say, I need help with this, and they're going to help find that resource for you and direct you that way. There's a lot of caregiver support and education and a variety of topics that are going to be available. So your mom with dementia and your mom with dementia are going to look completely different. You may have trouble with swallowing, you may have trouble with this. They can help guide that education so you know exactly what you need to do. There's also medical oversight, which is really important because of the number of specialists that are out there, and medication management. When my mom had open heart surgery 4 years ago, she had 3 different prescriptions for her potassium, and my sister and I, both being in the healthcare field, we couldn't figure out which potassium prescription was the correct one, because the hospitalist gave us one and her PCP gave us one and another doctor, her cardiologist, gave us one. So I know it's hard to navigate, and that's where you need that resource to help with that medication management or make that appropriate referral. And then there's respite care services. So according to the GUIDE program, there is up to $2,500 a year that each participant can use towards respite services. So that might be going to adult daycare, or it might be a stay at a assisted living or an independent living community that offers respite care. So that's a huge amount of money for Medicare to put on the line for the caregiver. Really, it's to help the caregiver. And like I said, you can't be a good caregiver if you can't help yourself first. So it's kind of nice that they put that in the program. The best part of all of this program is provided at no cost to the Medicare beneficiary. So no deductible, no co-pays, nothing. The service is being provided. So I've listed a few of the local resources here, and I can share this presentation with Nicole because I actually have links to all of these resources, so you can go online and look them up. The Greater Missouri chapter for the Alzheimer's Association is located in Creve Coeur. Again, you can go directly to their website, but you can also go to the Missouri chapter website, and they'll have some more specific things that are happening in the St. Louis area. Memory Care Home Solutions, like I mentioned, is down on West Pine. Empower Me Wellness is based in Brentwood, and they provide therapy services at different communities in the area. They also offer a nurse practitioner to help with some of those services. Continuum Care and Private Home Care are 2 private home care agencies that work with providers of the GUIDE program, and they can offer some additional assistance to you. I know you've got great home care support here on the Friendship Village campus, but sometimes it's nice just to know there's some other options out there. And something I recently learned about is called the Caregiver Club, and it is a not-for-profit that's designed to help caregivers when you're taking care of someone with dementia. And they'll have like little meetings and events where you can bring your loved one with dementia, maybe go to a restaurant that's dementia friendly to do some of these different things. So these are just a few of the resources that are out there, but there's a ton out there. And then I listed my information as well, because I would love to help you guys if you have any questions. So in summary, I would just want to say you're not alone. There are a lot of resources out there. You just need to say, I need help. You may not even know what you need help with, but just say, I need help, and there's people out there that will help you guys.